Friday morning, came on Saturday morning, ended up playing in the Patriot game, and have been coming twice a week since then. And has been, it's really been phenomenal how much better my body feels. You know, I basically get an overall treatment, but with an emphasis on my back. And it's just phenomenal how much it's helped me and how much I think it's going to help keep me playing football for a little while longer. I talked to a lot of my teammates. One of the first people I talked to, because he had a real tight shoulder, was Warren Moon. And Warren ended up coming in and having tremendous results. So we've just had a ton of guys that have come here and have all had great results. And it's just been the alliance or the affiliation with Delos that the Houston Oilers have kind of forged, player by player, has really been an added benefit to our football team. Since Ray Childress has been coming here, he's come here starting consistently in 1992, and he had his best year ever at 13 sacks and went to the Pro Bowl for the second or third time, and had really no injuries. Played an injury-free season, and I don't know if. Obviously, it's a blessing if you don't get hurt, and there's some other things added to it. But the bottom line is to keep your body loose and fit and in shape is extremely important, and that's something that you really get here when you come to Delos.
Well, after 4 years of trying to find the answer, whether it be therapy, whether it be an operation, or whether it just be go home and take an aspirin, you'll be better later, I was tired of that search. I had a very serious airplane accident, and it's the particular reason why I came here in 1989, and had broken the C1 and 2 and 4, 5, 6. To the best of my recollection, I've been to about 12 doctors over the past 4 years, and some very, very fine doctors, some that I had known while I owned the New Orleans Saints, from the sports end of it, ones that I had an awful lot of confidence in. Through lots of doctors, lots of time, lots of wasted energy, as it turned out, trying to find a cure. And I feel very confident. And as I said, I've tried all different kinds of therapies. None really worked until I came here, until I met Kenny Owens.
I was surprised to find out how many muscles around one area that hurt were involved in the problem that was causing the hurt. I referred many of my friends and many of my patients to Delos. In my experience, for a given myofascial disorder, neuromuscular therapy requires less office visits because it is a more intensive type treatment compared to traditional physical therapy such as ultrasound, interferential, etc.
I had no idea, no concept that I had tight muscles all over my body. But after they were loosened up, I felt like the first time I had taken an hour nap. It was an incredible experience. I don't think physicians really get into the relationships between muscles and disease. And I think that's something that in the future it needs to be looked into in a scientific study. I think neuromuscular therapy is essential to anybody that has any kind of muscle problems at all, muscle tightness, and I think it's important as you get older to keep that tightness down and relieve some of the other symptoms and some of the other problems that you experience as you age. Several of your clients and prospective customers, and they've asked my opinion for a reference for your center, and I've always been very positive about Delos. I think you do an outstanding job. Another aspect of this is that it's less expensive than some of the treatments that are currently in use, and I think that has to be looked at. And I think it's important that neuromuscular therapy be looked at as a viable means of reducing healthcare costs. Well, I think all physicians should look into this, and not only from just a referral standpoint, but as a prescription. They should, if they feel that it can help their patients, they should prescribe this treatment. They won't have to send them out for pills or other medications. And I think the insurance people need to understand that this therapy system, neuromuscular therapy, could be a viable alternative to expensive healthcare methods and reduce the cost of healthcare dramatically.
I had gone to a specialist a few years ago when I first started having the discomfort, and went through some physical therapy, such as ultrasound, things like that. And then I went through some treatments of anti-inflammatory and muscle relaxers, and I didn't like that aspect of it because I didn't like the drugs. So I tried various other things. I tried herbal remedies, I tried acupuncture, I've tried different things, and nothing really worked until I found this place. Until I found the Delos treatment, nothing really helped.
One of the things that we liked about Kenny's program, from a third-party administrator standpoint, who's administering health plans and who always feels as TPA that one of the first duties is to not only provide competent health care, but keep costs down on that health care. We all know that the cost of going to neurologists, the cost of going to chiropractors is very, very high. Have you ever gone to a neurologist or a chiropractor and not had anywhere from an X-ray to a series of X-rays taken? And so you always wind up with a lot of X-ray costs in addition to anything else that's done. And very interesting that the cost for treatment at the Delos Therapy Center is very, very reasonable, very low in comparison. And I haven't heard of an X-ray being taken yet either. With neuromuscular therapy treatment, the X-ray is not a needed item. The cost is very insignificant. Well, in the self-insured arena, obviously, one of our prime objectives is to keep people well and achieve wellness so that we don't have to incur the heavy health care costs. One of the advantages that we've found in both our coming and the people that we've recommended is that not only do they get treatment for muscular problems and muscular fatigue and muscular stress, but additionally they get an awful lot of instruction and advice on proper diet, proper foods to eat to achieve wellness. When we talk about insurance companies, certainly I'd recommend heartily that any insurance company look at incorporating this into their plan. It's foolish to not incorporate it into the plan because it first will improve the health of the people that we're serving, and that's the most important thing. And then secondly, it'll drastically cut the costs.
I can just see the long gains that I'm going to get through this. I look forward to see what I look like in 3 years. It's immediate gain is great, but I think the long gains and what I'm going to feel like when I'm 50, 60, 70 is going to be unbelievable. As far as pain and disability concerned, and in my teaching of senior citizens from all over the world, to me it's just nothing but muscle problems. And I think, because I can see certain people that are blessed with loose muscles and they've got a free ride, but there's certain people that if they only knew that this existed, they would go through life much more enjoyable.
I've been going to a chiropractor for a number of years, which really helped me, but finally I guess it was wearing to the degree that basically those treatments didn't really seem to help anymore. So since I've been coming to Delos, I have not had one of those 2-3 day episodes that I used to have. I believe that this type of therapy for one thing, it does keep you more limber. I mean, I'm walking, living proof of that. Insurance industry and at least the insurance company that continually refuses to pay mine is very short-sighted, because the small amount of money that I've spent over the last year at Delos has saved them plenty of thousands.